Intro and AMP. Hook your 17 days past ovulation. Your period is officially late, and every little twinge and wave of exhaustion has you asking that one big question: is this finally it? The 2-week wait has stretched into 17 very long days, and the symptom spotting is probably in overdrive. So, let's break down what could be happening in your body right now, what it all means, and what you should do next. The science of 17 DPO. What makes day 17 so significant? Well, if you have a pretty standard 28-day cycle, you're now about 3 days late for your period. If you conceive this cycle, the fertilized egg has likely already implanted into your uterine lining, a process that usually wraps up between 6 and 12 days after ovulation. Once that happens, your body gets the signal to start producing the pregnancy hormone, HCG. At the same time, another key hormone, progesterone, stays high to support that uterine lining. This hormonal duo is what's setting the stage for all those early signs you might be noticing. The 17 DPO symptom breakdown first, and most obviously, a missed period. If your cycles are regular, being a few days late is one of the strongest hints of early pregnancy. But it's not a guarantee. Things like stress, diet, or intense exercise can also make your period late. So while it's a fantastic sign, it's just one piece of the puzzle. Then there's fatigue. And we are not talking about just "I'm a bit tired" fatigue. This is that deep exhaustion that makes you want to call it a night at 7 p.m. This is caused by a surge in progesterone in early pregnancy. But here's where it gets tricky: progesterone is also high right before your period. This makes fatigue a super confusing symptom, since it's common whether you're pregnant or just about to start your cycle. Let's talk about cramping. You might feel some mild, pulling, or tingling cramps in your lower abdomen. In pregnancy, this can be a sign that your uterus is starting to stretch and grow. Then again, these can feel almost identical to the cramps that scream, "Your period is coming." The main difference people report is that implantation-related cramping is often lighter and doesn't ramp up in intensity like menstrual cramps typically do. And of course, there's nausea. That classic queasy feeling, which definitely doesn't just stick to the mornings, is a direct result of rising HCG levels. You might also find yourself suddenly turned off by foods you usually enjoy. While some people feel a little nauseous before their period, that persistent, lingering queasiness is much more common in early pregnancy. Finally, let's touch on breast changes. Are your breasts feeling sore, heavy, or more tender than usual? This is another classic sign caused by rising progesterone and estrogen. You might even notice your areolas look a bit darker. But again, since sore breasts are a very common PMS symptom, it's another one that can easily be misinterpreted. What if I have no symptoms? Now, what if you're sitting here at 17 DPO and feeling absolutely nothing? Take a deep breath. It is completely and totally normal to have no symptoms at all and still be pregnant. Every single pregnancy is different, and for some people, noticeable symptoms don't really kick in for a few more weeks. A lack of symptoms does not mean you're out of the running for this cycle. Next steps: when and how to test at 17 days past ovulation. You are well within the ideal window to take a home pregnancy test. By the time your period is a few days late, your HCG levels, if you are pregnant, should be high enough for most home tests to detect. For the most reliable result, try to use your first urine of the morning, since it's the most concentrated. If you get a faint positive line, that's still a positive. It just might mean you ovulated a little later than you thought. If you get a negative result but your period still hasn't shown up, don't lose hope. It's possible you ovulated later than you tracked, so wait another 2 or 3 days and test again. Conclusion and AMP, CTA. So, To sum it all up, the most common 17 DPO symptoms, a late period, fatigue, cramping, nausea, and sore breasts, are all driven by the same hormones that can signal either early pregnancy or an on its way period. The wait can feel agonizing, and it's okay to feel all the hope and all the anxiety that comes with it. Please be kind to yourself during this time. If you're in this waiting game, I'd love to hear from you in the comments. What DPO are you, and what are you experiencing? For more support on your journey, make sure to subscribe and become a part of our community. You are definitely not alone.